Hey everybody, welcome to Big Dr. Osborne's Brain. Today I'm taking your magnesium questions. Now I'm going to dive into some of the top questions that we've gotten already. Does magnesium help with better sleep? And the simple answer is yes. There's several mechanisms at work here. So one, if you're constantly stressed, maybe at work, maybe in relationships, one of the places we hold our stress is in the muscle, right? And stress actually causes wasting of magnesium through your kidneys. So when our cortisol's high, we lose magnesium through our urine. That magnesium loss leads to an increased tightening and muscle contraction in the neck and the back and the spine, which can affect sleep because it can affect how well you relax. So that's one mechanism. The other is through neurological receptors called NMDA receptors. These specialized receptors in your nervous system help calm and relax the mind. They get you ready to be able to go to sleep. So magnesium has two very unique effects. It can cause calming and relaxation. It can also, and that's through the nervous system, it can also cause a relaxation of your muscles directly. So yes, the answer is yes. Now, if you're trying to sleep better, my favorite kind of magnesium to use is magnesium threonate. That's threonate. It's bound to that molecule. That molecule can pass the blood-brain barrier. And there's some decent, robust studies in animals that show definite improvements in brain uptake of magnesium by using magnesium threonate. And there's some pretty good studies even in humans that show that it improves sleep parameters, sleep quality, and perception of recovery from sleep. So definitely something worth looking at if you're struggling with sleep. I use it quite frequently in my practice, specifically magnesium threonate when patients are having a harder time going to sleep. And I have found it to be very useful and very helpful for them. Okay, now that brings us to another question, which is, can magnesium help with anger or anxiety? Now, these two both fall in the same category: sleep, anger, anxiety. Magnesium is Mother Nature's natural relaxer. It calms the mind, it calms the brain. And it does this, one, through the NMDA receptor. It's an antagonist to that receptor, so it calms down hyperexcitability. But the other component here as to how magnesium can calm anger and anxiety is basically magnesium calms the muscles. Again, going back to what we were talking about earlier with sleep. So you have this effect where when we are angry, when we have high levels of anxiety, we make more cortisol, we make more adrenaline, we make more noradrenaline. This all causes compression, and not just compression in the muscles directly connected to your bones, so the muscles of your neck and spine, but also it effectively reduces or increases spasm in the muscles that feed your blood flow. So you get restricted blood flow. And anytime you get restricted blood flow, you get restricted oxygen. It's a feedback loop that tells your sympathetic nervous system to make more adrenaline, noradrenaline, because we're trying to improve oxygenation. So all that's going to lead to symptomatically an increased irritability, anxiety, etc. So magnesium very much can help calm the mind and calm the person. Now, one of the other mechanisms is through inflammation. There's a lot of research that's come out on inflammation actually of the brain causing anxiety, causing depression. So, it's always been thought historically, if you watch TV, that depression or anxiety is a chemical imbalance in the brain that requires prescription drugs to alter that chemical imbalance. And in reality, it is a chemical imbalance. It's just not the one that you've been taught. The imbalance is inflammation. And one of the things that we know about magnesium, I'm going to show you a couple of studies here on inflammation, but this was a study done on increasing magnesium in cancer patients. So these cancer patients were going through treatment. They had, in this case, it was lung cancer. And so they gave them a magnesium supplement. And what did they find about their inflammation? They found that it lowered it. Their levels of TNF-alpha, tumor necrosis factor alpha, interleukin-6, and C-reactive protein were significantly reduced just by simply adding magnesium to the mix. So changes in magnesium concentration can improve nutritional status and inflammatory response. So we know magnesium plays a role in modulating, regulating, or downregulating rather aggressive inflammation. And so in that regard, keeping in mind that inflammation of the brain can manifest as anxiety and depression, but also inflammation as a whole can manifest as pain. And so some people don't realize the importance of magnesium in pain management. This is actually one of my favorite go-tos because there's multiple mechanisms by which magnesium can help people that are suffering with chronic pain. And this includes if you've had traumatic injury. This also includes those of you who maybe have spinal cord issue or a herniated disc or spondyloarthritis or inflammatory arthritis of autoimmune nature. Like all of these different conditions, there have been human studies where magnesium helped outcomes and parameters. So one of the reasons why, as I mentioned a moment ago, I keep mentioning the same mechanism, but magnesium blocks NMDA, which hyperexcitability of your nervous system increases perception of pain. And that's one of the reasons why it can work so well for pain. Now, magnesium also relaxes muscles through its control of contractility of muscles. So when you relax muscles, you improve blood flow, but if those muscles are really tight, it can also contribute to joint compression and other problems that manifest as pain. Magnesium reduces inflammation through several mechanisms. I just showed you one in cancer studies, but it also improves blood supply. So when you get more blood to an area, you get more oxygen to an area, you can improve healing and repair. So if you've got chronic inflammation, chronic pain, and you're not using or considering or measuring magnesium, it's just a strong recommendation that I have. There have been human studies found to benefit fibromyalgia, chronic low back pain, and that includes spondyloarthritis. There was a question somebody asked in the show on Tuesday, does magnesium help with spondyloarthritis? It can. Migraines, menstrual pain, and even neurological or neurogenic pain or neuropathy. So I like magnesium clinically for all of those things. Okay, so then just wanted to show you one other mechanism of magnesium as it relates to joint health and osteoarthritis, because it's another form of pain that many suffer from. And so you can see here, there's a growing body of clinical studies pointing to intimate relationship between magnesium and osteoarthritis. One of the reasons why is that low magnesium induces human fibroblast senescence. What does that mean? It kills off the cells that make cartilage. So those cells start dying. Magnesium supplementation was also able to mitigate chondrocyte apoptosis. The chondrocyte also is important for making cartilage, and apoptosis is when those cells self-destruct. So magnesium mitigates that. It reduces that from happening, but it also facilitates chondrocyte proliferation. So basically, you make more chondrocytes that can make cartilage. So if you have damaged cartilage, you're basically making more cells that have the capacity to repair from that damage. And that's what osteoarthritis is. It's generally the arthritis of wear and tear. It's the arthritis of age. And so many people struggle with this and just have no idea of the benefit that magnesium plays in cartilage formation. What medications lower magnesium? There are several. There's a laundry list of these. I would recommend any of you watching, if you want to get the full show and slide notes, comment magnesium below and I'll send that to you and you can read all those individually. But I'm going to touch on, because I have more detailed diagrams in those show notes, but I want to touch a little bit on some of the medications. So one of the big ones is diuretics. So diuretics are commonly used in people that have lymphedema or swelling of the lower extremity, or in patients that have high blood pressure or risk for heart attacks or heart disease. Diuretics are go-tos in cardiology. Problem with diuretics is they cause magnesium loss, but it's not just diuretics. So there's another commonly used medication for pain, which is corticosteroid. Corticosteroids also deplete magnesium. So if you're taking steroids for an arthritis or for an autoimmune condition or to mitigate some type of injury pain, know that you're wasting your magnesium, like as long as you're on that medication. Now, that doesn't mean if you need this med that fear taking it. It just means that if you're gonna take it, know that it's causing magnesium loss and consider supporting your magnesium on the other side. But we also know that like alcohol and caffeine can drive magnesium loss. This is why those heavy coffee drinkers struggle so much with poor sleep and muscle cramps and muscle spasms and pain. This is one of the reasons why. I'm not talking about your 1 to 2 cups a day. kind of mild to moderate drinker. I'm talking about the folks that buy the stop and go 72-ounce coffee mug every day and fill it twice. Like the heavy coffee drinkers really will drive down magnesium. Now there's certain antibiotics can drive magnesium depletion. Certain chemotherapeutic agents can drive down magnesium. That study I showed you a moment ago on lung cancer patients, those patients were being treated with chemotherapy, and I think that's one of the benefits of why supplementing their magnesium helped lead to reduction in inflammation, because that chemo basically acts as a poison on those patients, trying to kill their cancers, but simultaneously it's poisoning their bodies, causing the increased need for magnesium. So these are some of the more common medications. If you follow what I like to call the vicious cycle, when people get on drugs, without understanding the root cause, right? So it's like superheroes. When you have a disease, doctors oftentimes just jump to the medicine to treat the symptom and then say, we don't really know what causes it, or hey, it's genetic, and so then take this medicine for the rest of your life. And there's no at all conversation about the origin of where that disease came from. And what I mean by superheroes is all superheroes have this origin story. And just, I would encourage any of you that are watching this that don't have an origin story about why you have that diagnosis, seek the origin story out. In the case of oftentimes of high blood pressure, for example, in this scenario, we know magnesium deficiency can cause high blood pressure. We know that supplementing magnesium in humans in many studies shows reduction in both systolic and diastolic blood pressure, because magnesium relaxes blood vessels. Remember, your blood vessels are muscles, and without magnesium, they stay constricted. That increases pressure. Now, doctors who don't ask this question just jump right to the diuretic. Well, what happens? You get magnesium depletion, and look at all the downstream consequences of magnesium depletion. Depression, blood vessel constriction, reduction in bone mineralization and cartilage formation, muscle spasm and pain, and cardiac arrhythmias like AFib and other problems. And then below this, you can see some of the medicines that are commonly used for these conditions, and several of these medicines actually feed back into magnesium depletion. So I mentioned diuretics, but HRT is another one, hormone replacement therapy. And it's become more popular here lately in the news, like estrogen therapy for women. And I'm not opposed to it, but I think I am opposed to it if somebody's just going on it without monitoring and without looking at their nutrition first, because these medicines can definitely cause magnesium depletion, as can SSRIs. So you've got, if you're on an antidepressant, right? And that's the irony there is it feeds back into the deficiency, which drives the depression, right? Or drives the vasoconstriction, which drives the very disease that you were trying to treat with the medication in the first place. So you lose in this scenario if you don't think of the origin story of where your disease came from. That's the important takeaway message. But bottom line, these are some of the more common medicines that we know deplete magnesium. Is magnesium recommended during pregnancy? Depends. So if you have been diagnosed with hypertension of pregnancy, then absolutely yes. This is actually one of the treatments is magnesium for elevations in blood pressure during pregnancy. So if you are pregnant with high blood pressure, ask your doctor, whoever you're working with, measure your magnesium levels. And don't stop at serum. A lot of doctors, because they're not trained in nutrition, which is unfortunate, but they will measure your magnesium in your serum. And this is a very, very inadequate, inaccurate way to measure magnesium. Remember, only 1% of all of your body's magnesium is in your serum. And if we're measuring that quantitatively, it doesn't account for the other 99%, which is predominantly stored in your bone and your muscle. So what's the best way to measure? Ask for INA, intracellular nutrition analysis. This is a lymphocyte proliferation test. I know these are big, fancy words, but this is the technology that works best. This is the one I recommend the most. Okay, now a good close second would be red blood cell magnesium. But these tests would help you, give you an indication as to whether or not you needed more. And magnesium supplementation is very safe. And so a lot of pregnant women and a lot of doctors, because they're not trained in nutrition, they don't know what quite to do with pregnant women because they're thinking, oh, I don't want to do anything that could hurt hurt the mom or the baby, which is respectable and which is a valid thought. But magnesium is very safe. What are the doses of magnesium as far as safety is concerned? Well, we can get up decently high, but in the U.S., if you live in the U.S., they have what's called the upper level intake, and this is based on, in the U.S., it's based on a 1997 review that was done by very, very, very conservative doctors, and they set the upper limit around 330 milligrams. And because a lot of people don't know what upper limit means, they think upper limit, oh, that's the max. If I go above that, I'm getting in trouble. Upper limit doesn't mean that at all. Upper limit is simply based on the fact that some people in some studies started to have loose bowels when going above that number, not toxicity. So this upper limit does not represent toxic levels of magnesium, and that's very, very important to understand. Is if you don't know what this terminology means, you think toxicity, you don't think just, oh, possibly some loose bowels might be at play here. But safely, many people can go up to 1,200 milligrams a day. Now, if you're going to go that high, I don't recommend you do that without monitoring your levels, especially if you have chronic kidney disease. But what would I say is a pretty safe, even for pregnant women, anywhere between 300 and 800 milligrams a day is pretty safe. No, I mean, magnesium toxicity is extremely rare. And at any rate, this is probably a pretty comfortable range, especially if you're overweight, if you're pre-diabetic, if you have gestational diabetes. Those are all kind of risk factors where magnesium might play a better role in supporting you through that pregnancy. So can you take it? If you're pregnant, you absolutely can. Now, you should also eat it. That's also an important component. Oh, I think I got it all. So let's dive into your questions live here on the board. Hagar says, are there any cases of muscle cramps and spasms when taking magnesium? And if so, what is the cause? Yeah, there are. So that's one thing. That's a good question. If you're taking magnesium and you start cramping, worse. Now, I assume that's what you mean, because there's two sides to this. We know that low levels of magnesium can cause cramping and muscle spasm. But we also know that if you're taking magnesium at higher amounts and you don't have adequate calcium or you don't have adequate potassium, you might start cramping. They work together. They're synergistic. And sometimes it's not magnesium even causing the cramping. It's actually the potassium. And what happens is you get that magnesium up really high and you're already calcium or potassium low. It's going to show up as cramping as well. So keep that in mind. This is why I'm a big fan of testing and testing multiple nutrients, not just testing one nutrient at a time and firing high doses. It's looking at the whole array of the clinical picture of what the patient is low in nutritionally. Could chronic low potassium be caused by low magnesium? It's not that chronic low potassium is caused by low magnesium. It's generally that a lot of the magnesium and potassium are found in the same food. So generally they kind of are associated with one another. When one's low, a lot of times the other one is low as well. But low magnesium itself doesn't cause potassium to start dropping. What would you recommend for a heavy coffee drinker, no sugar, no cream, so a decade-long heavy coffee drinker? What would be helpful for the withdrawals? Withdrawals around coffee, well, I would use magnesium. Magnesium's helpful in that regard because when you cut coffee out, generally you can get a lot of cramping and a lot of spasming and blood flow issues. So magnesium would be on that list, but so too with vitamin C, so too with vitamin B3, those two things. And I would even put glycine in that mix and possibly even choline, just depending on your symptoms. But a lot of the side effects and withdrawal stuff, like I'll put stars by So those three would be for withdrawal aspects, and then these two, magnesium and glycine, would be more for the side effects of the symptoms that you might experience directly from stopping. Now, if you're trying to quit, some people can quit cold turkey just like that, no problem. Others kind of have to wean themselves back. So if you've been doing this 10 years and you try to quit cold turkey and you pay a heck of a price symptomatically, consider doing first backing off by about a quarter. So instead of just going, I don't know how many cups a day, let's just use easy math. Let's say you drink 4 cups a day. Now instead of 4, drink 3. And do that for a couple of weeks, and then go from 3 to 2. Do that for a couple of weeks and just kind of slowly wean or titrate yourself down. Let's see here. Gonna take your multis that has B's, C, and magnesium and other vitamins. Will niacinamide, nettle, chamomile, herbal teas, moringa, milk thistle tea may be helpful? I don't understand your question. I think maybe you're asking about the addiction thing. So I mean, you can switch to those herbal teas. They're not going to change the nature of the addiction. They'll change the nature of what you do in the morning in terms of if you're used to a hot beverage in the morning, they'll help that part of it, but they're not going to reduce the potential of your side effects. Niacinamide will, but less so niacinamide than actually vitamin B3 in the form of nicotinic acid. Let's scroll down on the right. Thanks for showing. Yeah. I have celiac and I can't have protein shake. Instead, I bought lost supplements from different aminos. I put them all together and drink. Is that okay? I don't know what lost supplements are. Maybe that's a typo. Mara, re-ask your question. It looks like there might be several typos in there preventing me from understanding what you're trying to ask. My mouth is so sore I can't eat much. The deepest crevices of my buccal skin, especially in the lower front and part of my mouth and tip of my tongue, so sore and deep red. So you got magenta tongue. You got probably, Shalene, you probably have a major B vitamin issue. I would get a very, very high quality B complex vitamin. We have something called B Complete. I'll put a link below and you can check that out. But use that. I would do 3 to 4 a day. Do that for a couple of weeks. The good news about cracks and pain in the mouth like that is the mouth is a very fast healer. Every 2 to 7 days or so, those cells are regenerating and they're new. So if they don't have B vitamins, you're going to get redness, magenta tongue, you're going to get cracks and fissures, and you're going to have pain. So getting those B vitamins in you consistently over the course of a few weeks should have a pretty good impact. And if that's not doing it, I mean, obviously get your doctor also check it out. But that if you're talking about nutrition support, that's where I would start. There's a part 2 to that question though. Swollen. Okay, so my tongue is swollen and it's going numb on the tip with painful white papilla. I've tried lysine, coconut oil, vitamin C, and B12. Yeah, so going back to B vitamins, not just B12. NAC seems to work the best, but it's temporary. I feel like maybe I'm mold colonized. It's possible that you could be. My doc doesn't know the cause and wants to try antibiotics. It doesn't look, what you're describing doesn't really sound like an infection. I mean, before I would do antibiotics, Shalene, I'd ask your doctor to run a culture, do a sputum culture or a culture of your mouth to determine if you have a major issue before you just blast yourself with antibiotics. Because if you're colonized with mold and you take an antibiotic, it's going to make the mold colonization worse. Remember, the direct adversary to yeast and mold in the body is bacteria. So when you wipe out your bacteria, it's kind of the cat's away, the mice will play. And that's the thing. When you wipe out the bacteria, the mold will have a field day in you. Let's see. Jessica says, Dr. O, on your food sensitivity test, can you explain what is the Candida screen of Candida albicans? Yeah. So what that's measuring is it's measuring IgG and IgA against Candida albicans, which is a type of yeast that lives in humans. But if you're making high levels of antibodies against it, what it basically means is your body's trying to go to war against it. So you're going to get collateral inflammatory damage as a result of that. And it probably means deeper that you are colonized, over-colonized, because every human has some amount, small amount of Candida. But when your immune system starts to attack it, it's usually because there's an overgrowth. It's growing out of control. And this is where you've got to try to pull it down. Now, there's some natural ways to support this. Caprylic acid's a good thing to look at. Olive leaf extract, uva ursi, berberine, grapefruit seed extract are all natural things that have the ability to help balance out the flora. And so you might attempt to do some of those things. But that's what that result is alluding to. Okay. If you deplete your magnesium from bones and start supplementing, how much to replenish the bones and how long would it take? Depends on the person, depends on how depleted you are. I mean, you're not going to deplete all of it because, I mean, you store quite a bit of magnesium in your bone. But let's say, for example, you've gone a long period of time on medications that are driving out your magnesium or under tremendous amounts of stress driving out your magnesium. This is one of the reasons bone loss happens, is that your bone is a reserve tank for minerals, including magnesium. So as you're under that high level of stress and losing those minerals, your bone will break itself down to make sure that those mineral levels in your blood are available to your cells. And so your bone, your reserve actually, picks up the slack. So part of it just depends on how long that's been going on. It's different for different people. But as a general rule of thumb, my experience, if we're trying to correct magnesium deficits, symptomatically we see great improvements sometimes within a matter of days, but a good kind of litmus is a few months, up to as many as 6 to really get good recovery. So Jessica's asking about the food sensitivity test that you took. Jessica, your question's kind of nuanced because you're talking about the gluten sensitivity, or the Gluten-Free Society delayed food sensitivity test, which we have made available for people to buy online, compared to an IgE test, which that test is not. So IgE is a separate type of test that measures allergy. So you can have an allergy, for example, in your case, to oyster, basically an IgE response. But if you're doing the online delayed food sensitivity test from Gluten-Free Society, that is not measuring IgE. It's measuring IgA, IgG, and IgG subtype 4. So I don't know if that answers your question, but that's the difference. What causes side stitch and how can I treat it and keep it from happening? Generally, that side stitch like that is diaphragmatic spasming, and it could be calcium, magnesium, or potassium deficiency. It could be heightened loss of fluids if you're running, because a lot of people get those runner stitches. But when you run, it's very interesting. Athletes really have a tremendously greater requirement. Some suspect 30% increased requirement for magnesium above kind of the standard governmental recommendation. So if you're an athlete exercising and you're getting that stitch in your side, and even if you're not an athlete, maybe you're just getting the stitch in your side and you don't exercise much, you could be dehydrated, you could be taking diuretics, you could be not getting enough fluid that has enough electrolyte, you could have high levels of stress that are draining your magnesium or other electrolyte levels. But bottom line, if you're an athlete, and then I say running here, but it could be any other kind of athlete, especially if you're sweating heavily, your requirement for magnesium is 30% more. But it's because exercise depletes magnesium at a faster rate, both through your urine and because it's being mobilized from your bone. It's being also depleted through your sweat. So we've got increased excretion of magnesium much higher, about 30% higher excretion rate after aggressive exercise. And so if you're not considering magnesium supplementation and you're a heavy athlete, you might suffer with stitches and cramps, etc. So I know the question is there something I can do about the stitch? Yeah, you consider magnesium, but also consider potassium, consider calcium, and also think about hydration factors. Are you getting adequate fluids? Are there any other variables going on in your life that would cause you to lose fluid more rapidly, certain medications, too much caffeine, etc.? But that's where I would start. That's a really good place to start. I've had chronic symptoms for many years: fatigue, exercise intolerance, shortness of breath, muscle weakness, brain fog, cold hands and feet. My blood counts were always low normal, not normal, but low normal. So hemoglobin adequate, red blood cells. But after starting methyl B12 injections for confirmed B12 and folate deficiency, my MCV increased to 99. Do you think chronic B12 folate deficiency could explain this? Yeah, it could, but you could have more than one problem, right? So what you said is you were borderline low hemoglobin. So if you've got low hemoglobin, generally that's going to be copper or iron, possibly B6 deficiency. Hemoglobin is the protein in your red blood cells that carries oxygen, right? So this is why you get brain fog and fatigue, because when you don't get enough oxygen to your tissues, those are a very common consequence. Now, you also, if you had B12 and folate deficiency, B12 and folate are responsible. So in your bone, in your marrow, you have what are called erythropoietic stem cells that basically their job is to form new red blood cells. And this requires vitamin B12 and folate. So for those marrow cells to make red blood cells, you need B12 and you need B9, which is folate. And then for these red blood cells to properly mature, because when red blood cells are born, they're very large, they have a nucleus, but as they mature, they lose their nucleus, they shrink, they take on a bidiscoid shape, and they carry hemoglobin. So the nucleus is replaced by hemoglobin protein, and that's what makes them capable of carrying carbon dioxide and oxygen. And so the maturation process of red blood cells also requires B12 and folate. So there's multiple steps whereby you need those B vitamins to get from marrow stem cells all the way to mature red blood cells that functionally carry oxygen efficiently throughout your body. So it's possible you could have B12 folate deficiency, and it's also possible you could have copper and iron and B6 deficiency, or any combination of those different nutrients driving the anemia that all points at brain fog, fatigue, exercise intolerance, muscle aches and pains. Lack of oxygen is a deal breaker for our body. So that's where I would start. That's where I would look to understand it better. So testing, this is why it's so important to get tested, because there's so much symptom overlap between one nutrient deficiency and another nutrient deficiency and their functions, right? There's just layers upon layers of overlap that most people don't understand. And this is why if you take a kind of one symptom, one supplement approach to everything, you'll chase your tail for years and years and years. When counting total protein for the day, do I include protein amounts from nuts, seeds, beans, etc.? Yeah, when you're counting your total protein, you're just counting your total grams of protein. So if you're trying to hit a certain gram quantity amount in your day, yeah, all the protein consumption that you have would go toward that number. Now, that being said, some proteins have higher biological value than others, meaning low biological value proteins would be from plants. They don't contain all of the essential amino acids necessary to sustain human life. But when you're eating multiple kinds, you get mixes and matches, and it can work out pretty well. Whereas animal protein is a complete protein. It contains all of the essential amino acids needed to sustain life. But if you're counting all of your food together, you count it all towards your total protein intake. Now, if you're vegan, strict vegan, I strongly recommend you get your amino acid levels checked periodically to ensure that the diet you're choosing is basically comprehensively allowing you to get all of those essential amino acids in at high enough quantities. Can you explain how magnesium supplementation could help improve severe blood sugar regulation in a 13-year-old and will only eat white foods? Yeah, I mean, here, I'll give you one even better. Let's see here. Give me a second. Here we go. Nice image that we can pull up for you. So here, let's see, that's a little fuzzy. Let's back it off. So we'll blow in on this image and you can see it. But okay, so in this red circle, this is low magnesium. It's a little blurry, but and you can get these slides. Again, comment magnesium below the video and we will send you this entire slide deck of all the research around magnesium. And there's several slides on magnesium and blood sugar regulation. But low levels of magnesium can create reduced beta cell functionality. So it damages how your beta cells function. Beta cells make insulin. And so what you then get is your body, when you don't have enough magnesium, your body will respond by trying to make more insulin in an attempt to override this issue. The other thing that magnesium deficiency causes is it causes low-grade systemic inflammation. And it's that inflammation that impairs how your insulin works. So you could be making plenty of insulin, for example, but if you're chronically inflamed, the receptor activation is limited, doesn't work as well. So what do I mean by that? So we take rudimentary drawing of a cell. On the surface of that cell, you have an insulin receptor. And you have what's called a GLUT4 doorway. Now, if we're trying to get glucose, which is floating around in the blood, we're trying to get glucose into the cell through that door. And insulin is made by the pancreas, and it will come from the blood, and it will bind to that receptor on the surface of the cell. It will send a message to open that door. So we think of this in kind of a step-like fashion. So insulin binds to the receptor, the message gets sent through the cell, the door opens and glucose comes in, and then subsequent to that, we take that glucose, break it down, harvest the electrons, and we make ATP, which is the equivalent of energy. And now we can do stuff with that energy. Our body can repair, heal, maintain itself with that energy. And so magnesium deficiencies will disrupt how insulin communicates to that receptor. This is an inflammatory component. Magnesium deficiency drives inflammation. Magnesium is required to make insulin work properly, so it can affect how the insulin is actually made. Magnesium is also required once you get that glucose into the cell. You need magnesium multiple times to get to this energy. So it's going to affect you in every way possible, and that can affect how your blood sugar translates or how your glucose consumption from your food translates into what we want it to translate to, which is energy. So that's the main mechanism, and I hope that helps you. And again, comment magnesium below, and we'll send those slides to you where you can read them in more detail. Let's see here. If L3 and 8 mag is taken, is Ultra MG still necessary? Is it safe to take both in moderation? Great question, Joanne. It's safe to take both. It depends on what you're trying to do. So if you're taking, we have a product called Clear Mag. The reason it's called Clear Mag is because it's magnesium 3 and 8, and so we want that magnesium to shuttle through the blood-brain barrier more effectively, so that you can think more clearly. Hence the term Clear Mag, trying to get it to the brain so you can think clearly, make energy in your brain. Whereas Ultra MG is just a general supplement. It's got multiple forms of magnesium. It does not have 3 and 8. It has glycinate, malate, and citrate. So those three work really, really well. They're chelates, so they're absorbed really well. They're brought into the cell really effectively. And so this is for most people, a good generalized magnesium supplement with good research data to show that if you take it, you're going to absorb it, you're going to get it in your cell. And they're both good, but if our goal is brain function, sleep, I prefer using this one. If our goal is we're just trying to correct a generalized magnesium deficiency, we've got muscle cramps, muscle spasms, other generalized symptoms of magnesium deficiency, and there's evidence on a test that there's a deficit, I like this. Now, what I sometimes do is I have somebody that does have a sleep problem. What I'll have them do is before bed, I'll have them take 200 milligrams, which is 2 capsules, prior sleep, to get it in them right before sleep. And then if I'm combining, I'll do like 600, if I'm doing therapeutic amounts, I'm gonna do between 6 and 1200. But if I'm starting at the lower, more conservative therapeutic range, I'm gonna have them do 400 milligrams of this tri-magnesium. And so that's per day. So they'll take 2 in the morning, 2 in the afternoon, and then they'll take 2 in the evening before bed for that sleep component. And in that way, we're combining the best, but we're getting a lot of that at night where we want it to go for that calmness, for that relaxation. So that's one way that I would consider thinking about it. Do you take vitamin B1 and magnesium together? Yeah, you absolutely can. They don't interfere with each other's absorption, and they work. They're very synergistic together. As a matter of fact, a lot of people who take high-dose vitamin B1 struggle with side effects because they don't have adequate magnesium for activation. So sometimes we combine the two to reduce those symptoms of vitamin B1. I take a magnesium 1200 milligram complex before bed along with vitamin D3, K2, MK7, and still having cramps in my legs and feet. Okay, so this is a common mistake. This is a great question. If you are having cramps at night, this is usually a combination problem with calcium and magnesium, not just magnesium. So if you're taking 1200 milligrams of magnesium and not getting the calcium, you're going to continue to cramp. So what I would do in this scenario, we have a product called Ultra CalMag for this reason. I designed it for that reason because a lot of the night cramps are the combo. And if you're just getting the one, you're not going to solve the problem. So I would take this and I would start with like 6 caps, which is equivalent to, from a magnesium perspective, it's equivalent to about 600 milligrams of magnesium combined with 1200 milligrams of calcium. Make sure you continue to take the K with that component. And, you know, you should know a difference within a couple of days. Like if that doesn't work within a few days, and now you want to consider potassium. But generally speaking, nighttime cramps are calcium and magnesium. And it sounds like you're just missing the calcium component there. The celiac disease sucks. I could see that. I could see that, Jody. It sucks that you have to have a restriction in your diet. However, we'll say this: what's awesome is knowing that you have it, and not having the subsequent side effects of what happens when you have it. And like celiac disease is linked to not just to the gut, but I mean, if you go on eating gluten, you have a 400% increased risk of early death. So to me, yeah, it sucks that you have to change your diet, but it's awesome that you know that you need to, and it's awesome that you can live longer and healthier knowing that and having that information. So I think part of it too is just how you embrace it. And some people in the beginning really mourn food more than others, and this is not no affront to you, but we go through the phases of grief. It might be helpful for you to look at that. I was just talking to a patient about this a few days ago. Phases of grief. Got one extra in there. Actually, the phases of grief end in acceptance, but begin in anger, begin in bargaining, and kind of where you barter with yourself. I'll just have a little, that kind of thing. But the quicker you can get through those phases of grief to acceptance, the less it sucks. And I'm just saying that because I don't know where you're at in your journey, but I'm just from the perspective of having walked thousands of people through this process, we see it very, very commonly. That anger really gets them. But you ultimately want to overcome that. I just received my copy of No Grain, No Pain. Yay, I can catch up with class. That's awesome. You don't have it. If you're a celiac or a gluten sensitive and you haven't read No Grain, No Pain, you're missing out. You're missing out on a lot of great health. And that's not to say, that you're not healthier going on a traditional gluten-free diet, but if you don't know the difference between a traditional gluten-free diet and a true gluten-free diet, I promise you're missing out on very robust amounts of health. What is therapeutic NAC dose, oral or IV? Doctor to give a 10-year-old to clear excess mucus from pneumonia. So you've got excess mucus from pneumonia, and you're wanting to know for a 10-year-old, what is a therapeutic dose? You could ask your doctor about IV, but it's not necessary. Oral NAC works just fine. Oral NAC at anywhere between, if we're talking about a 10-year-old, I don't know how much that 10-year-old weighs, but 500 to 1,000 should do the trick, and it's safe. And that's milligrams. As a mucolytic, you'll get plenty of mucolytic response. I mean, if the 10-year-old is, 75 pounds, probably start with the 500 milligrams. But if we're talking about a big 10-year-old, up over 100 pounds, I'd probably go as high as 1,000, maybe more, depending on their response. NAC's super safe. Like, as far as side effects, like, you'll know if you get stomach aches and pains, you're too high, as a general rule of thumb. But it's huge track record of safety, and even at higher doses, very, very effective. Which forms of magnesium are most helpful for the autonomic nervous system, including nerves outside of the CNS? All of them. I'd say we can answer that question, Melinda. Even the simplest way to answer that question would say which forms are not effective, more than we can say which ones are effective. Magnesium oxide. This is one, unless you just want to relieve your constipation and create an osmotic effect in your bowel and, have loose bowels. All the other chelated versions of magnesium, glycinate, malate, bisglycinate, threonate, citrate, they all work pretty well. They're all absorbed pretty well. A lot of people try to overcomplicate this. So like, oh, well, magnesium taurate because of the heart, because taurine in the heart, and there's a connection. There's not a therapeutic amount of taurine in magnesium taurate. So it's not like it's going to go and just be this massive benefit on the heart, and you should only take that form of magnesium for the heart. The same thing would be true of magnesium threonate. I prefer to use it when we're trying to get sleep because it does pass the blood-brain barrier, but that's probably one of the only differences amongst the different forms of magnesium where I have a preference. But citrate and glycinate are going to work pretty equally. Aspartate's going to work pretty well. They're all going to be absorbed, and they're all approximately the same quantity of magnesium elementally in the same size capsule. And so they're all pretty good if you don't have all the other junk fillers and all the other nonsense in the pill. I mean, that's really where we run into problems with supplements, is either they put a bunch of stuff that doesn't belong there. One of the things I hate seeing in a supplement is rice powder. It's like, why would you put rice powder in a supplement knowing everything that we know about rice being contaminated with cadmium and lead and arsenic? It's just a bad choice, and there's better options. And if you're gluten sensitive, it's a bad choice in that regard as well. And then it's just quality. Do they have the amount that they say they have, right? That's part of, with supplementation, that's part of why we do triple testing when we do our products. We do warehouse testing before that. We order that product from a supplier, that product comes to our warehouse, we test that product to ensure that what is on their label actually matches what we're getting. Then from there, we create our blends, and then we test a final product to ensure that that the magnesium is there and that there's no contaminants or other issues. And then from there, we check at intervals because we like to know that our product is guaranteed dosing on the date of expiration. So like the way we do our expiration dates is if our product has a 2-year expiration date, what I can tell you about that product is the dose on the label will be at least that much after 2 years. And so that's where we do that third batch of testing, is to make sure that our product says what it is even on the date of expiration. Beyond the date of expiration, we don't do any more testing, but we know up to that point that the product is valuable. A lot of questions came in on Tuesday about how do you evaluate different products and different supplement companies, like what criteria? And it's a hard one because it's really, the FDA has some degree of oversight, but there's a lot of fudging that goes on in the supplement world. And we've actually kicked products out. We kick products out on a regular basis, like raw supplies, because sometimes we'll see a batch that might have a contamination of lead, or sometimes we see a batch that might have something that looks a little off and we're not quite sure. And so we kick that stuff out. We don't want any of that nonsense in our product, but a lot of people will they'll put it in because they don't have a standard. It's very expensive to test things before you formulate. And that's why a lot of people don't go through the rigor because it's not a requirement. Anyway, been having painful toe, foot, leg cramps. How much magnesium? Yeah, I would do, if you're having cramps, like I said earlier, especially at night, I'd go with about 600 milligrams of magnesium, 1,200 milligrams of calcium, and I would do that in 3 divided doses over the course of the day, but take your final dose before bedtime, kind of right before bed. And also, again, look at your fluid intake, look at your water intake, look at quantitatively how much you're sweating, because a lot of people this time of the year, like I'm in Texas and it was 100 and something degrees yesterday, and if you're outside for any length of time, you're wet, you're sweating more. Sweating induces loss of electrolytes. So if that's happening to you right now, you're going to be more prone to it. So just keep those things in mind. Let's see. GABA, looking for a therapeutic dose, general for pain with lovely NMDA over reactive type pain. If you've got NMDA issues, then there's a few things you should be looking at. One, you should be looking at glycine, 3 grams a day, supplementally. 2, you should be looking at theanine. 3, you should be looking at the topic of the day, which is magnesium. And 4, GABA. And so from a dosing, 3 grams, theanine, anywhere from 200 to 600 milligrams per day, magnesium 6 to 1200, and then GABA, 500 to 1000 milligrams. But these are all NMDA receptor antagonists, right? So if the mechanism of your pain is neurological hyperexcitability in the neurons, and you're trying to antagonize NMDA, this is your go-to. That's what I would jump on. Is topical magnesium soaking in Epsom salt adequate for general support instead of ingesting? We don't have any data. I have seen people do really, really well with topical application as far as acute symptomatology, but we don't have any real data on is topical or Epsom salt soaking equivalent, for example, to 600 milligrams of this type of magnesium. There's no data. Nobody's done those trials or studies. And I generally, because there's no data, I try to, in my clinical practice, I try to follow the data with a lot of my recommendations. And because there isn't any, I'm just not saying, hey, why don't you do magnesium oil instead of magnesium? I generally am saying you can do both, but we're going to get oral supplementation in for sure. Let's see, Mel, did you put up the show notes? So those of you in the live feed that are asking for the magnesium notes, we're going to put that link in the live feed, because later when this is no longer live, most people won't find this. So we're putting that for you right now as you're in the live feed. So look for that link in the feed where you can go, just click it and hit control and click it, and it'll open up a window and it'll take you right to that page when you're done with the show today. I was diagnosed with pancreatic insufficiency. Doctor wants to put me on PERT, but is there anything I can take for it instead? And is there a way to not be insufficient? Best way to not be insufficient, in my experience, is right here. If you're not already here, grain-free. A lot of pancreatic insufficiency is gluten-induced inflammation to the pancreas. A lot of it can also be just other types of inflammation. There's actually 4 major triggers for inflammation that will drive pancreatic insufficiency that we see. The first is food, and that grain is the biggest culprit, but food as a category. The second, microbes. There's certain kinds of gram-negative bacteria and yeast that can drive inflammatory damage. Number 3 is chemical exposure. A number of different toxic compounds that we're exposed to, dyes, preservatives, additives, pesticides, herbicides in the food, those types of things. And then 4 is nutritional deficiencies. So there are a number of different nutrients that the pancreas requires in order to function and maintain its functionality really, really well. And so if you have any of these triggers, you could develop pancreatic insufficiency. So the best way to go about it is measure for these triggers. Remember I was saying earlier the origin story of your illness. So what is the origin of your illness? Probably this. If you have a chronic inflammatory problem, this is your origin story. You've just never heard it yet. Nobody's told you that before. But that's root cause, right? Is that these are the triggers typically. There are other things possibly, but these are the most common, and they should always be measured. And I mean, look, if you're struggling and you don't know what to do and you're on polypharmacy, multiple medications, and you've got more than one doctor because you're going to different ologists and specialists, and they haven't done this diligence right here, take a step back, read the last chapter in No Grain, No Pain. And I put it all, this is all in there. I put it in there. I put the instruction blueprint for you to understand that those things right there are what are driving forces behind the chronic inflammation that causes your body's tissues to malfunction. And it's not rocket science, folks. It's just that it's not profitable. That's my opinion. I'll go off on a rant here, but in medicine's all about profit. It's patent profit approach. This is why, some of these newer drugs that are coming out cost thousands of dollars a month, right? They don't cost thousands of dollars a month for that manufacturer. It's just that they're new. So they patent the drug. They get the rights to produce it, and they know they can up the fee. And if you've watched anything over the past few years, you've seen just like outrageous costs. And some folks in our political spectrum are trying to bring some of those costs down, which I think is ultimately a good thing. I think a lot of what we're being charged in the U.S. is way over and above what the rest of the world pays for their medication, and it's profit motive. It doesn't. And when you have the corporate buyout of medicine, so like a lot of your hospital systems have been bought out by hedge fund managers and other major corporate entities. And so you take the humanity out of medicine, and you basically, it becomes a profit game. It becomes the bottom line for the shareholders. Can we profit the shareholders better this quarter by doing more of these procedures, by charging more for this particular drug? And it's sickening. Especially when the root cause of the vast majority of chronic inflammatory conditions are right here. 4 simple things. Anyway, read No Grain, No Pain. The last chapter spells it out, and that's where you need to begin your journey. And then from there, you can get more nuanced. I was diagnosed, let's see, I got that one. Let's see, scroll down on the middle for me. What can help with hemorrhoids? Figuring out what caused them. Generally, hemorrhoids are swollen blood vessels in the rectum or in the large intestine. And so something's irritating the area. And usually the case is it's food. For a lot of people, it's sugar or dairy. Many people, it's grain. So if you haven't looked at diet change, I see this all the time when people go on a no grain, no pain diet, they stop having hemorrhoids. They just go away. because when you inflame that tissue and the blood vessels engorge to that area to try to bring in nutrients to heal and repair the damage from the inflammation, that's what a hemorrhoid is. It's what creates the hemorrhoid in the first place. Now, from an acute perspective, there are certainly creams over the counter that you can get that can reduce that swelling, but that won't fix the problem. That will only resolve some of the aspect of your symptoms in the short term, but it won't resolve the problem in the long run. What causes lightheadedness or drained feeling during the day and it improves before bedtime? You probably are seeing a cortisol spike, I would imagine. I mean, that's just a speculation, but if you're in the middle of your day, so when you wake, so if we look at cortisol and so if this axis represents the quantity of cortisol and this axis represents time, generally speaking, and this is morning, so early morning, and then this is, let's just put midnight over here. What's supposed to happen is your cortisol is supposed to spike and be really, really high in the morning. And then as noon hits, it kind of drops a little bit. And then as the day goes on, it drops a little bit more. And then when it's bedtime, it drops a little bit more. So cortisol curve should look something like this. As a diurnal hormone, it just fluctuates, right? We need more in the morning and it slowly dwindles as the day goes on. But sometimes what will happen for a person is instead of having this nice kind of lazy L-shaped diagram, we'll get that initial spike, we'll get a big drop. And so we might see somewhere in that early kind of noon time or pre-noon time that we'll get a big drop, and then we might get a rebound a little bit later on. And so you've got just an abnormal cortisol curve. And so this can be caused by a lot of things. And for many people, we say stress, right? Because cortisol is a stress hormone. But what does stress really mean? Like, stress is such a generic term. So I like to really look at stress as different flavors, if you will. So there's actually, we'll undercomplicate it. So we've got emotional stress, we've got physical stress, and we have chemical stress. So what an example of emotional stress, you got in a fight with a friend, you got in trouble at work, or whatever happened emotionally, you're just distraught, maybe you had a relationship that went south or whatnot. Physical, this would be like a lack of sleep, or you exercised too much and you hadn't exercised in 6 months and you went all out and you got super sore and you're just really stressed out from that. And the chemical would be like, microbial. Think chemical stress, think anything that comes into your body that you can't see that can affect you and drive stress and inflammation. So infection or microbes, this could be food sensitivities, this could be, chemical exposures to things like pesticides or food dyes and food gums and other things that you eat that are not good for you, that translates into chemical stress for your body to have to deal with. Right? So these three things are where you really kind of want to think, where am I at? And then from there, you can kind of reverse engineer, okay, why would my cortisol curve be misfunctioning? And because normally, if these things are dealt with, we get that nice, smooth, lazy L, for the most part. There are times in life where life just throws a curveball your way and there's not much you can do about it. And you just have to weather that storm. But what we want with stress is we want these things to be thought about so that you can create stress resiliency, so that you can weather the storms when they do come, because they will come. But if you're not resilient, then this thing will start looking very, very odd and you'll start crashing. You'll have day crashes. Now, sometimes crashes are also hypoglycemic crashes. Now, when you're hypoglycemic, that triggers a cortisol response as well. But so look at too, are you trying to do intermittent fasting? And that's part of why that's happening. But those are things that you can think on, and hopefully that helps. What types of magnesium do you recommend? I personally use, I use magnesium glycinate, citrate, and malate, along with threonate. Those are kind of some of my better and more preferred forms, just because clinically they've worked really, really well for me. How much extra magnesium could you need to take when you're stressed and peeing it out? So approximately 200 to 300 milligrams extra. So if you're finding that you're under a tremendous amount of stress and you're just trying to support your body, if you aim for that 200 to 300 milligram range just to help make up the difference, you should also try to eat foods that are rich in magnesium. But that would be a good place to start. Can too much magnesium cause 24/7 pounding pulse sensations? I believe I've taken too much and triggered an overactive sympathetic nervous system. It's not typical. Look, if you have taken too much and you've backed off, you're going to see those symptoms go away within a matter of a day or two. So they shouldn't be lingering. So sometimes what happens, and I'm not saying this has happened to you, but this is just what I've seen sometimes, where people introduce a supplement and experience some kind of a symptom response negatively, and then they come back and they say it was the supplement that caused it, right? And that could be true. I'm not saying it can't be true. It does happen that way. But a lot of times what I see is somebody introduces a supplement, experiences symptom from something else, right? Other than that supplement, but it happened around the same time. So there's a coincidental symptomatic, blaming here. And so part of how you figure that out, like the easiest way to figure it out is, okay, stop the supplement, then the symptoms should reduce and go away, okay? Because we're talking about water-soluble nutrients here, magnesium being water-soluble. And so generally a pretty short half-life, it'll be in and out of your system relatively quickly, and the symptoms should go away. If the symptom's not going away, then the likelihood that it was actually the causation of the supplement, we kind of start ruling that out, and we start thinking about what else went on, what else might be happening that coincides. Because what we don't want is we don't want that guilt by association. And again, that's not to say the supplement didn't cause it in your case. I'm just trying to give everyone some context around when you're taking a new supplement and you're experiencing a new symptom, you have to think about this other thing. And so the way that you do that is you stop the supplement. Does the symptom go away? If the answer is yes, then it was the supplement. If the answer is no, then it was probably something else that you're associating with the supplement. And then you have to reverse engineer, figure out what that something else may be. But it's not a common side effect, by the way, just so coming back to the question, it's not at all a common side effect to have a pounding pulse sensation from magnesium at all. Before learning from you that they are bad, I took and caused burning in my esophagus. What do you think this happened? Dexlansoprazole. So you took a PPI and it caused burning in your esophagus. What do you think? Why do I think that happened? I think it happened because you were blocking your stomach acid. So these are parietal cells, and they produce acid. So, well, we'll just call it HCl. Okay, and then that HCl interacts with your food and it helps you to digest it. And so what happened is you blocked this. And so your food wasn't getting digested. And so that undigested food created an irritant that worked its way up and created a burning sensation that was misdiagnosed as heartburn. And so that's why the doctor put you on that drug. And that's why when you got off of it, that went away, because you started making stomach acid again, you were able to digest your food again, and then, gangbusters, now your gut works. That's most likely the mechanism behind why you struggled in that way. Whenever I get a bug bite, it gets super red and puffy. What can I put on it to reduce that? Doctor only suggested a steroid cream. My favorite thing, I have a big cactus plant in the backyard of aloe. And I'll take one of those aloe leaves and I'll break it off and I'll apply it to burns, scrapes, cuts, wounds, any variety of open sore. And it's immediately has a super kind of soothing effect because it's a cooling effect. So if it's itching or if it's hurting, it can dramatically improve your comfort level, if you will. But it's very anti-inflammatory. So it's a great way to with no additives, with no preservatives, with no nonsense, you just take the gel of the aloe and apply it directly to the bite itself. What natural additions can be taken for very high LDL-C, not interested in statins? Yeah, I'm not interested in even lowering LDL-C. I don't know why people are so obsessed with lowering LDL-C. I think it's stupid. I think well, maybe 50 years. I think we'll look back on that the way we look at leaching today. If you remember the science of the day, just about 100 years ago was to put leeches and treat the vapors. That was the science of the day, right? What's the science of today? Like, if you really think about history in the context of what people believe and why they believe it, and as time progresses forward, the people of the day believe the thing that they're doing in the day is the right thing, even if it sounds odd or weird. I mean, they were putting mercurials on wounds and cuts and scrapes and, feeding patients toxic metals and leaching them, and that was science. Today, it's not much different, in my opinion. And when you talk about cholesterol, it's not whether or not you should try to lower it. I mean, lower an LDL-C, why? We know that people live longer with higher LDL. So why would I want to lower something that doctors haven't been able to work this paradox out yet? And think about all the mistakes doctors make. We think doctors are super smart academic people, and to some degree, many of them are. However, oftentimes they're wrong, and history, as it plays out, proves that. But the paradox is that this being higher, you will live longer. And ask a cardiologist why that paradox exists, and nobody can explain it to you. I think it's because as we get older, we make more LDL. LDL is a precursor for hormones. And so I think as people are aging and damaging their bodies and their hormone level capacity starts to drop, their body's response to that is to try to make more LDL to help buffer and increase their hormone reserve. But I also think it's because people, as they age, are making so many mistakes along the way that their chronic inflammation has gone up. And LDL is a buffer for that. It's actually an anti-inflammatory buffer. So why would we want to block it? I think that's why people live longer. So why are you trying to lower it? And what does high mean? Because when you say high LDL, this is relative to pharma. How do we know that? When I started practice, normal cholesterol levels was 280. Then they dropped it to 250, then 220. Now it's at 200. Well, who's responsible for each one of these drops, historically speaking? Pharma. When you look at who sat on those panels, it was always either all pharma shills or mostly pharma shills, meaning doctors who were being directly paid and had direct conflicts of interest to be able to have the ability to make this decision. And each time you drop it, what does that do? It makes millions more eligible for taking a drug. And if you look at statins, statins are the most prescribed drug in the world and most profitable set of drugs. And we have started using statins. Well, it's almost been 40 years, I think. I don't remember the exact year they were brought out, but we have empirical data now where statins have been around for this long, and we don't have a reduction in heart disease. So I don't care what the study says. If the empirical data contradicts the research that was paid for by the very people that stand to profit from it, we have to look at empirical data, which is actual outcomes. We don't have less heart disease. We don't have less stroke. I mean, that's factual. But we use more statins. So how do statins help? Help me make sense of that. So I'm not trying to harp on you here, but I didn't have any context around your question. I'm just trying to give you more food for thought. But But your LDL, if you really want to know if your LDL is a problem, this is my opinion. If you need to lower it or consider lowering it, you really shouldn't base it on just the LDL-C. You should measure. This is a test you can ask any doctor to run, and its insurance covers it, but you should measure oxidized LDL, because it's the oxidized LDL that is driving plaque formation, not just LDL. All LDL is not just this, this evil, bad stuff that it's been made out to be. That's hence the cholesterol paradox. Let's see here. My autistic son, magnesium is extremely low on his hair test. Well, throw the hair test away, quit ordering them. Hair tests are inaccurate and shouldn't be used to make decisions. A given magnesium glycinate and multivitamin that has magnesium, however, he's still heavy metals. I don't know what that means. He still has heavy metals, maybe. Look, if you're relying on a hair test to do analysis of nutritional status, you're relying on data. It is very misleading. Don't buy any more hair tests. That's all I can really say about it. You always talk about the 4 triggers of disease, but shouldn't stress be considered a 5th trigger? Yeah, absolutely. That's a good call out, actually. So coming back to what we were talking about over here, so stress, if you think about this, what I said earlier, that there's 3 kinds of stress: emotional, physical, chemical. What are the 4 chemical drivers of disease? Food, microbes, chemical exposures, environmentally, and then nutritional deficiencies, right? So why are these chemical drivers of disease? Chemical is because you don't see them. They're things that you can't see that work biochemically inside of you and have a real outcome effect. Physical is what you can see, right? You can see the impact physically. So if somebody's overweight, if somebody is under-muscled, etc., these are physical things. Square tires don't roll. So this goes back to, these are all forms of stress, right? So when you say, isn't stress a 5th cause? It is, and these are subtypes of stress. So we could really, if we wanted to simplify this even more, we just say stress is the cause. But the problem with saying that is that most people think of stress as this flavor, emotional, and they don't think that my lack of activity is actually a form of physical stress, right? Not exercising is a form of physical stress that will end your life 20 to 30 years earlier. That people don't think of it that way. They don't think of food stress. They don't think of when they stop in at Taco Bell and get fake meat and GMO-based foods, that they just think that's a normal part of their day, but they're not thinking that that's a chemical form of stress, right? So the reason I really highlight these 4 instead of just, highlighting the stress is because these are the stress variables that can be measured and will make the biggest impact on a person, right? And there are other things in here too. So like as an example, another, where we get chemicals, not just food, we get chemicals in bad air or water, poor water, water filtration. But one of the other aspects here is sunshine, right? We could expound upon this. I'm sure everyone in the audience today could add in a little flavor or subset of the topic of this. But yes, you're absolutely right. Stress is a 5th cause, but that is the answer to your question, which is why I don't really talk about stress. It's because conceptually, what people think of when they think of stress is a very different thing than those 4 triggers. What nutrients break your fasting? Anything with calories breaks your fasting. If it's got caloric value, it's breaking your fast. And so in that regard, it would be carb, fat, protein, and including amino acids. Some people try to say that amino acids don't break your fast, but technically they do break your fast. I bought your SPMs for pain. Bottle says 2 per day. Is that divided dose or all at once? Divided doses would be more ideal. What nutrient could you take before going out in poor air quality if you have to when you have asthma? Yeah, NAC would be a good choice. I would also consider, I have a formula called Histassist. And it's got NAC in it, but it has other things in it as well. Bromelain and nettle, vitamin C. All these things work to stabilize mast cells, which are what release the histamine, right? That drive a lot of the symptoms, when we're being exposed acutely to bad air quality. So this is something that has just a synergistic formula of things, but NAC is one of the ingredients in it. So those of you that are getting hammered by all those fires in the north, that might be applicable in your case. And the other thing would be to avoid going outside as much as possible and have a HEPA filter inside to take care of you. What are the symptoms of Candida overgrowth? I don't think I have any red flags that stand out. Sugar craving, weight gain, brain fog, fatigue, muscle aches and pains, gastrointestinal bloating, especially when consuming carbohydrates, are some of the top symptoms of Candida. And we have a whole class on that, Jessica. I can put a link in to the feed there if you'd like to watch more on that and just get better perspective. And let's see here. I'd say vitamin D, magnesium. Okay, so what deficiency causes panic attacks, and or which vitamins and at what dose do you suggest to get them to stop? It's not what deficiency causes panic attack, because there's a lot of them, Jen, that can cause panic attack. I would say, magnesium would be the top of the list. Vitamin B1 deficiency, B12 deficiency, iron deficiency, other B vitamin deficiencies, because they all regulate neurochemistry. They all regulate how your body produces and regulates the interaction of neurochemicals that can drive anxiety or that can buffer anxiety. So, having an understanding of which nutrients would be the best line of thought around getting resolution if you have a nutritional driver of that anxiety. So test, right? Do an INA, intracellular nutrient analysis, and get the feedback on what other things could also be low or missing. The other thing is that what are you doing in your day-to-day life? Because a lot of anxiety is also driven by those same factors we were just talking about: food, chemicals, microbes, chemical exposures, nutritional deficiencies. Aside from the actual emotional stressors that might be in your life that could also be driving it as well. But it's complex. I have a whole class on anxiety too. It's very detailed and broken down. If you want that class, type anxiety in the feed, and I'll have somebody send that over to you. Just or Mel, if you can pull that class up, we can just drop it to her right now. Do food sensitivity results change? My test showed a moderate sensitivity to egg yolk, but my allergy test was negative. When can I reintroduce? I feel better and have less brain fog when I eat them. It's probably because of the choline. Xenia, have you considered choline supplementation? With food sensitivities, generally speaking, 6 to 8 months, you can make attempts at reintroduction. Your immune system recycles at 6-month intervals. The white cells in your body live and die in 6 months and give birth to new children that oftentimes there's a change in immune function at that point. Can you scroll down on the right for me? Chronic symptoms for years, confirmed B12 folate deficiency. MCV was always normal, but rose to 99 after methyl B12. Could iron deficiency have masked? Yes, it could have. How to improve MTHFR? I'm talking food-based B complex, magnesium oxide. I'm taking food-based B complex, magnesium oxide, citrate, and bisglycinate. I'm underweight with fatigue. It's not about you don't improve MTHFR. You have genes, and those genes are either predisposed to struggle or not. And it's not what you do to improve it, it's what you do to reduce the stress on it. And that's an important nuance. But for example, I have MTHFR, but I don't do anything special about it. Why? Because I don't have to, because I have a clean environment, I have clean food, I exercise, I go to bed on time, I get good sunshine, and I filter my air and water. Those are fundamental. So if you really want to improve your capacity in all things, including MTHFR, focus on those 6 strategies. But a lot of people want to supplement away their genetic SNPs, and a lot of experts online want to sell people with genetic SNPs as the solution to their genes that are somehow evil. But the context of the way I would encourage you to understand it, that your genes are not evil. Your genes are a gift. And when we start looking at MTHFR and we think, oh, I have this MTHFR mutation, I have bad genes. This is where a lot of people in their mind, this is what a lot of folks online are teaching, but this is also what a lot of people are thinking about it. And you never have bad genes. I mean, unless you're born with genetic disease like cystic fibrosis or Down syndrome, you don't have, and even then I would argue you still don't have bad genes. But think of it from this light. I'm just going to give you some philosophical structure to understand. So physical, chemical, spiritual, emotional. So this is what I call the triangle of health. And in the core is your genetic code, your DNA. Now, your DNA isn't a curse. It's not bad. It's a gift. Genes are a gift from God. Whether you're religious or not, I don't really care. This is my philosophy. Genes are a gift from God. They're not broken. What's broken is the choices that we make. Now, the outer walls of this triangle represent our choices. We make choices every day. We make spiritual choices. We make physical choices. We make chemical choices. What's a physical choice? You choose to go to bed on time, or you choose not to. You choose to exercise. You choose not to. It's a choice at the end of the day. And chemicals, what do you choose to put in your body and call it food? Is it food dyes and additives and preservatives and pesticides, or are you eating organically? Are you eating whole real foods? Like, these are choices you make every day. Now, on the chemical side, you don't make a choice for, big factories to pollute the air in the town that you live in. So there's some things that are beyond your control, but ultimately your genes are the gift. The inputs from the chemical environment, the physical environment, and the spiritual environment will activate certain genes in certain ways. And what are they doing? They're trying to protect you, right? So your genes are just adjusting and trying to protect you from the things you're being exposed to, many of which, again, are personal choices. Some are beyond your control, but most of them are within your control. What's the ratio of what's in your control versus not? Well, most experts agree that 70% is in your control, 30% is genetic, right? So the 70% being the outside walls of this triangle that you can control to the largest extent, 30% is the genetic overtones that occur. So your physical, your emotional, spiritual, chemical choices influence your DNA. Your DNA talks back and influences your choices, hopefully. So if you made a bad choice here physically and didn't get enough sleep, your DNA sends you a message. It makes you tired and fatigued, and you don't feel very well. And so hopefully that feedback mechanism helps you make a better choice next time. That's the way I want you to think about it. Now, in addition, your physical choices impact you spiritually. Don't think that if you don't exercise, it's not affecting you spiritually. Your body is your temple, and if you ignore it and you don't take care of it, it's a spiritual assault as much as it is a physical outcome. So spiritually affects you physically, physically affects you spiritually, spiritually affects you chemically, and chemical affects you spiritually. This is why, those of you during, the last 6 years or so that refused to get a certain said treatment, and this is no judgment on any of you who did it, but You're protecting yourself here from the chemical onslaught of your spirituality, right? If you have a biblical belief in the right to choose in that way. So they all impact each other, but they all also impact your genetic code. And then your genetic code is just responding to all of this. And so again, going back to the theme, your genes aren't necessarily bad. They're the gift. They're helping you survive, because if you had really bad genes, you'd just die from any little stress from the environment. But your body's so amazing, it adapts and it responds to even some of the worst types of scenarios and situations. So you don't fix an MTHFR. An MTHFR is who you are. If you have it, you adjust your environment to maximize for the MTHFR risk. So the risk would be, if you have an MTHFR, you don't methylate as well. Therefore, if you're exposed to chemicals more, it's going to show up as symptoms and as illness faster in you than it would in somebody who doesn't have that manifestation. And so you have to be more diligent in making better decisions here to build resiliency, so that you're supporting any genes that you have that might have a disadvantage. But for every gene that you have that's a disadvantage, you have genes that are advantages, right? It's not that, again, you don't have bad genes, you have a gift, and you just have to honor that gift by getting educated and making the best decisions that you can about how you treat yourself physically, chemically, spiritually, emotionally. Okay, let's scroll down on the right here. Where can you take an INA test? Can we drop the link in, Mel, for the INA for that question? Can I get a comp? Okay, let's see. Oh, ouch, help. I burned in whirlpool, first, second degree burns. One of the blisters over the outside ankles has had a scab for about a decade. Wow, that's a long time. Came off now. I have a hole, been using medical grade saline and sterile gauze. Clear liquid comes out of the hole. How did you heal? You're malnourished. If you're not healing from something that happened 10 years ago, you're malnourished, and you may have an infection in that wound. You need to, if you haven't already had it looked at, get it looked at, make sure it's not infected, because that could be a big problem for you. But if you're talking about just generalized good nutrition with a burn wound, you have to get enough protein. When you get a burn, protein is the rate limiting factor for healing and repair. And the number one amino acid involved in that is glutamine. So I'd be at like 5 to 10 grams of glutamine. I'd be making sure you got your body weight in grams of protein. Not if you're, I don't know if you're overweight or you're not, but if you're not overweight, your body weight in protein. If you're overweight, what your body weight should be ideally in protein. So if you're 110 pounds and you're a healthy weight, lean weight, 110 grams of protein per day. And that's where I would start. But ultimately, I would really get it tested. I'd look to get it tested for infection, but get yourself tested for malnutrition. Because if that's not healed in 10 years, you've got bigger problems. How much extra magnesium and other essential minerals and vitamins do you take when you have an autoimmune condition and on steroids to allow for what is being burnt up? You test. You don't mess around. If you've got autoimmune disease, you measure and you supplement accordingly. So Janice, get an INA test done to make those kinds of decisions. What's the best way to get in magnesium and calcium for someone suffering with chronic low blood pressure and POTS? If you've got POTS, look for the mold. If you've got POTS, look for mold in your environment. So, calcium and magnesium are fine. They don't necessarily cause low blood pressure if you have POTS. But you also want to take them and pay attention, because if you take them and you feel more tired or it makes your POTS symptoms worse, then obviously you've got to reconsider that. But I generally would say, like I've said many times today, get tested, measure to make sure you even need them. What about magnesium lowering sodium? You're not going to take so much magnesium that you're going to drop your sodium. I'm not worried about that, the vast majority of people. How do you get rid of RA nodules? Well, you get rid of the driving factors that are driving the RA. If you have a red, no grain, no pain, start there. read that, follow the 30-day diet, you'll be in the right direction. Zinc fixity. Will magnesium help with partially blocked arteries? It's a tough question. I mean, maybe. And we've got too much going on here. So if you've got a partially blocked arteries, let's say this is your artery, and then you have plaque, partial blockage. And so this is blood flow in this direction, and you want to take magnesium. And so what does magnesium do? So there's a layer around this blood vessel, there's a layer of smooth muscle. And that smooth muscle, in the state of magnesium deficiency, that smooth muscle will contract. And so it will narrow the artery itself. And so then you have reduction of blood flow because you have less volume flow because the artery has narrowed. So taking magnesium, it might expand the diameter because it's allowing the smooth muscle to relax. And in that way, it's going to improve blood flow. But taking magnesium is not going to make this plaque go away. Now, what it may do, magnesium is anti-inflammatory. So if we know that plaque formation is driven by inflammation, not by cholesterol. This is another myth of cholesterol. Cholesterol is not the enemy. Cholesterol is the guilt by association framework. But it's the inflammation that's the enemy. The inflammation creates the damage to the vascular lining, and then cholesterol comes in there and it tries to put the fire out, so to speak. And so magnesium could impact your vascular flow by reducing inflammation, and that's a possibility. But if I had arteriosclerosis or atherosclerosis, I wouldn't just say, everybody take magnesium and your plaque is going to go and your blood flow is going to automatically improve, because it's multifactorial and it's more complex than just magnesium. There's a lot of things that regulate inflammation. There's a lot of things that regulate the blood flow and the formation of plaques beyond magnesium. So to look at magnesium in the context of would that do it, it's too simple of a thought. It's more complex than that. Going back to what I keep saying, test, don't guess. It's complex, and the body is amazing and can do a lot of duct taping where it doesn't have what it needs. It can use other nutrients in place of other nutrients, and there's overlap between them. But if you measure, you get a blueprint for yourself instead of trying to, just watch YouTube videos and like piece things together, and hopefully taking certain things will work sometimes, and etc. But that testing, that measurement is what really gives you a blueprint to follow. I drink a pot of coffee a day and take 2.5 grams of magnesium bisglycinate powder hours later. Am I going to uptake it? Am I going to uptake it? I don't know what you mean by that question. The question doesn't make sense to me. Are you going to absorb that magnesium? Is that what you're asking me? I mean, are you sure it's 2.5 grams? You're taking that much? That doesn't seem likely. I'm not calling you a liar. I'm just making sure that's not a typo. I mean, you're going to absorb some of that, but if you're taking it all at once like that, you're probably going to create a heck of an osmotic effect in your gut that might drive loose bowels. That would be my thought. You are the first medical professional who told me that I needed more nutrients after my gallbladder was removed. By the way, it was removed in the mid-90s. I had obvious signs of vitamin K deficiency. It's sad, isn't it? It's sad that we don't have a better trained arsenal of doctors who understand nutrition. Your thoughts on meat, salt, chocolate, vitamin C hurting the kidneys if feeling a kidney problem? I mean, I don't think those things hurt the kidneys. Meat doesn't hurt the kidneys. Salt doesn't hurt the kidneys. The kidneys are already hurt. And if you do things that put pressure on the kidneys, and the kidneys are already inflamed and hurt, then it might show up as the perception that those things are hurting your kidneys. A lot of people have abused their bodies for a long time. And so what they have is they have lifestyle-induced kidney inflammation. And so all the things they've done, all the choices they've made up to a point have driven damage to their kidneys. And so then, doctors have said, well, don't eat protein because you're in kidney failure. Your body requires protein. It needs protein. Not eating protein is not the solution. Vitamin C is not hurting your kidneys. Now, with vitamin C in chocolate and, and spinach and some other things, a lot of people will talk about oxalates, and oxalates are toxic to the kidneys. Oxalates are not toxic to the kidneys. Your body can deal with a certain quantity of oxalates. It's not oxalates per se. It's when you're dehydrated and your kidneys are failing and you're eating an abundance of oxalates and you lack the nutrients that break oxalates down. Oxalates, to break those down, one of the nutrients is B6, another one is zinc. And so if you don't have enough of these nutrients and you're eating tons of this food and you have pre-existing kidney inflammation, then you're going to have kidneys that are just struggling because they're underwater. But those foods inherently aren't bad for the kidneys. If it's normal, natural food or a nutrient, it's not bad for the kidneys. It's the things that you've done up to the point where your kidneys can't take it anymore. So that's the way you should think about it. Do you know if the supplement TMG is helpful in lowering blood pressure? It's possible. If you're low in glycine, it's possible that it might help. What would you do for frozen shoulder? Evaluate why it happened in the first place. So we do a history. But in my experience, the general reality of a frozen shoulder is malnutrition coupled with low-grade movement with no overhead movement. So a person sits at a desk for most of their day. Their arms never go above their head, and their rotator cuff muscles atrophy. And when they atrophy, they have a limited range of motion. Their muscles are atrophied. So now when they go and do something like on the weekend or go and do something like try to put a long sleeve shirt on and have to lift their arm over their head, that shortened atrophied muscle group combined with lack of use and disuse atrophy breaks up some adhesions that have formed as a result of that. And now, boom, we've got an injury. So that's typical. That's really typically what I see. So to fix that, you have to start doing things above your head. You have to work up here. Oops, hitting that. You've got to work above the head. And so one of my favorite exercises is the pull up or the pull down. And if you can't do that, if you're not strong enough to do that, get you some of those bands. And you can do pull downs, but you need to have arms above head regularly during your week to maintain the integrity of your shoulders to prevent or avoid developing rotator cuff problems that lead to frozen shoulder. Couple that with the malnutrition. So like we already talked about magnesium. So magnesium deficiency can contribute to or drive arthritis in joints. We know that other nutrients are also important for the formation and the elasticity of muscles, collagen, tendons, ligaments, and the other physical structures that make up your shoulder girdle. And so if you're malnourished or if you have a chronic inflammation that's damaging that tissue, those all have to be investigated. So when you ask me what I would do, I would investigate all of those things. If somebody came to see me for that, we do a full history, we do a full examination, we do some lab testing, and then we would come together and we'd create a comprehensive plan based on the reasons that person developed that problem. Because frozen shoulder is, although we see generic patterns that are relatively true across the spectrum of different people that have that problem, there's also nuance, and understanding that nuance sometimes is the biggest difference between getting it fixed long-term and allowing that person to continue to struggle. There's no one size fits all. It's the bane of medicine is this damn one size fits all, the one medication for all the one kind of disease, or the multiple medications for the one kind of disease. It's like, here's your label, here's your drug, here's your label, here's your surgery. And it's, in my opinion, it's done more detriment to the health of the world, and it has done benefit. And I'm not talking about acute care medicine where you got your life was saved because some wonderful surgeon in an ICU put you back together. I'm talking about the mass scale social acceptance of self-deprecation promoted by doctors and not called out by doctors, whose job it is to call out the bullshit and to be honest. And they're actually lying and saying, take this drug, even though we don't know what caused your disease because they haven't trained properly. That's what I'm talking about. And so, it's a whole paradigm of culture that has been curated from ignorant and weak people who don't have the courage to say it the way it is for fear of offending somebody and hurting their feelings. And the worst thing you can do to somebody is be dishonest with them. This is why in the Bible, the lie is one of the biggest sins. It's because dishonesty is greater than just a little white lie. It's greater than the doctor saying, oh no, your obesity is not that big of a deal. Just take the GLP-1. No, the doctor should be saying, no, the obesity is going to kill your ass if you don't make some meaningful changes in your life. Not here's a crutch, right? Let me teach you to fish, not give you something that basically refrains you from having to take personal responsibility over why this problem happened. And doctors have failed to do that. That's why our healthcare system sucks. That's why everybody's sick. That's why everybody's disappointed. And that's why if you look around, like where I live in Houston, the skyline and the medical skyline is like Vegas. It is like a massive billions of dollars into these massive buildings where people go to get care. And what they really get is they get money extrapolated out of their bank accounts over fear-driven nonsense and dishonesty that's gone on for far too long. Anyway, honesty. Hormonal shifts in perimenopause also causes anxiety. Okay, that's just a comment. How many grams of pumpkin seeds do I recommend daily? I don't recommend a certain quantity of grams. I think incorporating some pumpkin seed into your meal is a good way to get magnesium, but there's not like, you got to have X grams a day or you're going to develop a deficiency. Would you use itraconazole in some mold cases? Can it kill Candida? Would I use it? No, I don't have a license to prescribe medication, so I personally wouldn't use it. Now, I might refer somebody out, to a colleague to get it, but it's not something I would say is a common thing that I see as necessary. Most people with mold cases, their persistence in symptoms is actually because they didn't get a proper mold inspection and proper remediation, or they didn't get out of the mold. And so a lot of doctors, oh man, that is such an open can of worms of a conversation. Because I've been through it myself. I lost my house to mold. I know exactly how it works. You get a shitty mold inspector that doesn't know what they're doing, but they're licensed. And so the people that live in the house think, oh, they're licensed, therefore they must be qualified. Therefore we have to, that report is a good report. And what most people don't realize is the vast majority, this is my opinion, vast majority of mold inspectors aren't qualified to be mold inspectors. In Texas, you need a weekend class to get a license. That doesn't qualify you as an expert. A weekend class doesn't qualify anyone an expert in anything. I mean, think about the times you've spent learning. And think about how in the world could you develop mastery over a topic in a weekend? It's impossible. I mean, most experts at their craft have spent years under the tutelage of another expert who also has years of experience. But a weekend class, anyway, you get people that are called experts that have a weekend class and training that do a crappy job of an inspection, tell the client they don't have mold in their house. And so the client is at a loss, and the doctor gets that report from that patient and says, oh, well, the mold inspector said you don't have mold. Must be that you have mold colonization. Let's give you itraconazole. When in reality, what actually happened was they had mold in their house, but the inadequate inspector, failed to do due diligence and do a good job and didn't find it. And therefore, maybe put the nail in the coffin of that patient, because mold can kill you. Anyway, it's a big problem in this industry where you get, not only potentially bad mold inspectors, but you get bad mold remediators, and then you get doctors that don't know the difference that are treating these mold cases that then get confused when people don't get better because they're not actually going in and reading the mold reports and reading the inspections. They're not doing the environmental building sciences in their non-patient clinical hours to understand this stuff. And I was guilty of it myself. Like I didn't know anywhere near as much as I did before I lost my house to mold, but I had to get wise very quickly because the mold inspector that inspected our house and cleared our house initially almost killed my family. I mean, literally lied to us and said, one week he says, we don't know why you have a mold problem. We know you have a mold problem, but we don't know where and we don't know how to fix it. And the very next week he comes in and he performs an air test in my home and he clears my house after saying that he didn't know what was causing the mold. He clears my family to stay in that tomb, would have been our tomb. And when we tapped the wall cavity, we found in some wall cavities hundreds of thousands of black mold and aspergillus and penicillium that was just spewing mycotoxins into our living airspace. And this asshole said it was fine. Anyway, I'm pretty opinionated about this topic because it almost killed us. And I see it very, very regularly. So when you ask me that question about itraconazole, I would encourage you more than taking that, would encourage you more to make sure you've had a forensic mold inspector come out and do a damn good job before you start thinking about taking antifungals, because it's highly unlikely that you're colonized, because most people, once they get out of the mold, their immune system recovers. Their immune system can win the war against the Lyme, against the Candida, against a lot of the other problems. But when you're immunocompromised because you're living in mold and being exposed to massive quantities of the toxins that molds produce, it's very, very hard to overcome those types of situations. How C. difficile causes fear or anxiety in someone. So C. difficile makes an endotoxin or what's called a lipopolysaccharide that permeates through the gut barrier and traverses into the systemic circulation, and it can get to the brain and it can drive inflammation in the brain that causes that fear and anxiety. It's an inflammatory response in the brain that's driven by the toxin that the bacteria produces. And again, once it permeates into the bloodstream, it can go anywhere, including the brain. Is it worth taking Akkermansia? I think it's overrated. I think there are cases where it can be worth it, but I think when it comes to probiotics, we don't know enough. I mean, we know a lot, but there's a lot we don't know. And so what we're doing right now is that there are a lot of really great and intelligent, doctors that are doing research on these different types and strains, and they're finding different aspects or different parameters around certain benefits. But I think a lot of times when you see the commercials and you see the marketing and the push, I have not clinically seen one-off probiotics dramatically reverse or change people's lives consistently. It's not to say I haven't seen it, because there are definitely cases in anecdote where Akkermansia has worked really well, for example, for weight loss, or L-reuteri worked really, really well for somebody's mentality and they saw the world in a different way after taking it. So that it's not to discredit any of you who've had that experience. It's just to say, as a general whole, it may be worth it and it may not be worth it. But I think a lot of times we see a lot of hype and things. And so the promise of the marketing is greater than the reality of the outcome for many people. Okay, one more. Let's go down just a bit. I had shingles and I was told I have to get vaccinated in 1 year. Is there anything else without doing that? I don't know why they would tell you that in 1 year. Why would they tell you that? So the first thing is if you want to get that type of treatment, that's the decision you have to make. I'm not going to tell you to make it or not. I can tell you what I would do, which is I'd never put any of that crap inside of my body, but that's my own opinion about myself. Shingles is herpes. It's a type of herpes virus. And if you've had it recently, then what happened was your body started to make antibodies to help clear it, to help protect you. And you have memory cells. Your immune system has memory. And so you might still be making antibodies that are protective, what we call protective antibodies. So if you were to be exposed to this again in the future or go through a big bout of stress, if you did get it, your memory should kick in and give you protection. I mean, the whole premise of getting a shot would be that this is stimulating you to make this. That's the premise. This is the basic premise of studies that basically, I don't want to say this without too much censorship. The premise of most of these types of studies is the outcome of, does that treatment increase this right here? Because if it does, then they call it a success. Because nobody can predict disease happening or not happening. Like, that's an impossibility, which is what makes a lot of this research, in my opinion, very pseudoscientific. You can't predict illness in the future. You can find variables that might help you increase the likelihood of guessing at what may happen in the future, but it's a lot like the weather. How many times is the weatherman wrong? It's the same thing with the doctor. How many times is the doctor wrong? How many of you have an experience with a doctor where they said, this is going to happen if you don't do X or Y, and it didn't happen? Or something completely different happened than what they said should have happened when you followed their instruction. So anyway, going back to shingles. So if you've had it, you're making antibodies and you have memory, and so you have protection. And so if a doctor's saying, hey, you should do this treatment, what they should be doing is saying, hey, instead of just saying, let's do that treatment, let's check your titers in a year. And if you have those protective antibodies, you really don't need to worry about it. That's what should happen. It doesn't. But I mean, my experience, most of the people doing those kinds of recommendations don't have, they really don't understand what they're recommending. If they understood it, they probably would be less apt to do that. I mean, most of it is well, I'm going to stop there. Let's see here. Does magnesium make the person feel dizziness? It can. Some people don't do well with higher levels of magnesium. They can get tired, they can get dizzy, they can get a little short of breath. It's just not, one, it's because they're not low in it. And two, it can cause an over-relaxation, if you will. And so that might contribute to some of those symptoms. So it's not, magnesium is definitely not a catch-all, fix-all for all things that we've talked about, but it's something that should be part of the conversation that you're investigating. Four weeks healing from a coronary artery bypass and mitral valve replacement. Blood pressure seems to remain low. One more week to see my doc. My BP still seems quite low, 91/44. Is that because I can't do good upper body exercise? It could be a lot of things. I mean, I would reach out to your cardiologist and have a more in-depth conversation, because after surgery, there's a lot of potential things to explore, and I think those things should be explored and not ignored in your situation. It doesn't serve me to give you, some generic stuff, because there's too much complexity in that. I am deficient in many nutrients, especially amino acids, unable to absorb even though I eat a lot of proteins. How do you know you're unable to absorb? Malabsorption is detectable and measurable. And if you suspect it, I would get it measured. You can do, fecal fat testing. Your gallbladder plays a role. Have your pancreatic enzyme levels measured. You can do GI tract testing that measures your capacity to digest and absorb carbs, fats, proteins, and other nutrients. You can measure enzyme levels. discern if you have malabsorption. And if you do, discern why, because your solution is there. It's not just taking more supplements, but it's within the context of why you might be malabsorbing. How can one detox from Lamisil antifungal? Stop taking it is the #1 way to start detoxing from it, and support yourself. Support yourself nutritionally. I mean, the kidney is going to heal and repair. Generally speaking, I don't know how long this family member was on that medication, or how much damage was done. But as a general rule of thumb, the fastest way to detox is to not re-expose. And then beyond that, there can be nuance to what the kidney might need to heal. And that's where individualized basis, case-by-case basis matters more than anything else. What's your opinion on IgG food sensitivity testing? I think it's okay. I think it's by itself, though it's limited. There's more than just IgG. There's, and you also have to pre-qualify it, or pre-qualify whether or not a person is making adequate immunoglobulin. But then there's also IgG4, which, you can make high levels of IgG for something, but you want to tease out IgG4 because IgG4 is actually protective. So you could be restricting your diet more than what's necessary if you're just basing it on only an IgG food sensitivity test. If a functional medicine doctor said folate helps prevent migraine, but only at a dose of 2,000, would you agree with him? I don't. Look, there's a lot of migraine prophylactics. Meaning, we could draw a lot of studies that show folate benefit, magnesium, vitamin B2, CoQ10, vitamin B12, iron, all as being migraine prophylaxis, right? So reducing or preventing recurrence or intensity of migraines. I don't think you can make the claim that only this dose works or only that dose works for anyone. I think ultimately any really good doctor knows that biochemical individuality rules, it wins. And so for some people, 2,000 might be necessary and others and maybe not so much. I think it depends on the person, but I don't think you can make blanket statements. I mean, I know I do that. I'm guilty of it. Sometimes I make generalizations up here in this pulpit that I speak from. But it's more in the context of just trying to educate you guys about concept more than it is trying to say this is fact and this is the only way. There's a different way for everyone. And the message that I hope that you all understand and that you all receive every time I talk is that one size fits all never works. I just spent 20 minutes ranting on the failure of medicine because of that approach. We can't take and hijack functional medicine and put it into that paradigm. We can't take what I think is the saving grace of the future of medicine. And I don't even like the term functional medicine. I think it's the wrong term. Because I think it's an alternative term. I've got a lot of opinions on this stuff, but functional medicine, to me, functional medicine doesn't mean it's just a marketing term. And if you recall, historically speaking, there are a lot of marketing terms that have come and gone in the alternative realm. If you've been around long enough, you already know what they are. You already can predict what I'm about to say. But in the alternative medical realm, you got integrative medicine. You got holistic medicine. You got naturopathic. And I know this is no offense to any naturopaths, because I know there's naturopathy and there's degrees of naturopathic medicine, but there's also the perception of the public and the marketing of naturopathic. And it very much has become, in many of the eyes of people, become a marketing term. And these things have all come and gone. They come and go. And I think functional is going to come and go. as long as we allow mainstream to have a monopoly over care, and the monopoly is largely financially influenced, meaning this group, what is the premise? This group says we have carte blanche license to diagnose, treat anything in any manner with drugs and surgery and medicine. And we're going to take the people over here in this realm and we're going to ridicule them. We're going to criticize them. We're going to call them quacks. We're going to create false propaganda about how these things help. We're going to talk about how it's quackery and that it's not real medicine and that it's not scientifically based, even though it's extremely scientifically based. As a matter of fact, we can make an argument for this because it's all the same. It's all the same. This is just wisdom. It's a combination of wisdom and common sense. And there's no place for wisdom and common sense here because this monopoly is about this, not about this. And so, you know, when we talk about that term functional medicine, what's happening right now that a lot of you may not see, I see it because I'm in the profession and I go to the conferences and I talk to peers. But what we're quietly seeing right now is a hijacking of the term. What you're getting is disgruntled, monopolistic MD, DO, not all of them, because there's some, look, this is also not a damnation of every medical doctor and osteopathic doctor, because there's a lot of great ones out there, for sure. But what you're getting is the people that want this, that are not happy with this system that's been created by them because they didn't have the courage to stand up and fight it. So now they're in a system they don't like, but they want this. And so what are they doing? They're coming over here to this functional and they're hijacking it. But what are they actually practicing? They're not practicing functional. They're practicing pseudo natural. They're calling drugs bioidentical. They're doing things like that. So they're not, instead of like, they jump right to hormone replacement. So instead of asking the question, oh, your estrogen's low, maybe we should look at your zinc. Maybe we should look at your folate because those nutrients are required to make estrogen. No, they're not doing that. What they're doing is they're using a medicine, calling it bioidentical and saying that's root cause. And so they're actually hijacking the movement of purists, doctors that believe in the wisdom and common sense of thousands of years of good information around diet, around lifestyle, around choice, around personal responsibility. And they're trying to take that and take it over too, because it's all part of this. That's what happens when this money becomes the priority over actually saving lives. Like this should be the priority. And I think most doctors, like they go into medical school or they go into their training and this is what they believe, but then they rack up $1 million in debt and then very real, this kind of starts to set in. And then some people, you know, they get power and autonomy over patients. And so if you read philosophy, you know that power corrupts and absolute power corrupts absolutely. And I think some of them, this is why we have an ego problem in medicine, is that they get to the level where they're in control of the patient and they use fear to continue to control that patient instead of using compassion, instead of having good bedside manner and having, trying to see the life of the patient through their eyes and trying to put themselves into the position of the patient. They just want the patient to do what they say because they're right. And that's a really, really immature, naive way to approach healthcare, but that's where we're at. So, what was the original question? The question was, do you agree with my functional medicine doctor that this is this? And that, no, the premise of any functional medicine doctor should be this. And if they're not, and if their philosophy doesn't match this, my opinion, you should run away. If you're looking for functional medicine and you're not getting this, then you should run. because it isn't functional medicine. Now, if you're looking for integrative medicine where they're using drugs plus natural things, okay, we can argue that. But if you're looking for functional medicine, then you need to find somebody who understands this: biochemical individuality. I don't care how many studies that are done that show correlations, that show patterns and themes. They're great. We can use them as general knowledge and file them into our arsenal of information that might be helpful. But at the end of the day, the doctor should appreciate that this is the most important thing: N=1. It doesn't matter what the studies said about people who aren't the patient. It only matters that the patient, who is the N, this is the patient, and the patient's reaction or response or to care or to treatment is their response and reaction to care and treatment, regardless of what a research study said. It's the patient's outcome it's the only thing that matters. And doctors have gotten so academically, what's the best way to put it? Arrogant is probably the best way to put it. They've gotten so academically arrogant that they think that they have the right to make the decision for you, or choose fear, or put fear in your heart to force you to make the decision they want you to make, instead of just being empathetic and giving you some damned informed consent so that you know the risks, the benefits, and trust you as the person who owns that body to make the best decision for you, irregardless of what anyone else thinks. That's where the doctor should stand. And N=1, now he should give you the best knowledge that he has, but if he's practicing functionally, there is no one size fits all. I don't know if I answered your question, Melinda, but I hope that was helpful. Okay, we'll do one more and then I got to wrap it up. I'm getting hungry. Let's scroll down just a hair. I think we got. Are there any supplements you would recommend for calcium and plaque in the arteries? Yeah, so probably the thing that has some of the best, if you're talking about natural, Tanya, one of the things that has the best research in human track record is nattokinase. Nattokinase. Now, there are other proteolytic enzymes as well, but nattokinase can break down the fibrin and the proteins that make up and create plaques in arteries. So that's got some of the best research. So I would look at that. I would look at probably serrapeptidase and other proteolytics as well, in that regard, if that's what you're trying to do naturally. Okay, I think that's it. I've got to run. My stomach is growling. I've got to go eat. Appreciate you guys. Appreciate you sticking with me through my rants today. And look, if you want the show notes for the magnesium show, again, just type that in below, magnesium, and we'll send that over to you. I'll be back on Tuesday for another masterclass, and next Thursday I'll be back again for a live Q&A. If you're not already signed up for our newsletter, do me a favor, go over to glutenfreesociety.org. You can sign up there for free. We'll send you a lot of free information on how to navigate diet and lifestyle to overcome chronic immune and chronic inflammation problems. And make sure you hit that subscribe and like below. Oh, I've been told we do have a coupon code this week for those of you who would like to support us, and we appreciate your support. Without you, we don't keep the lights on and do these shows. If you want to save 15% off of our magnesium, just use coupon code 15MG. 15MG is the coupon code, and you can save on our Clear Mag, which is our magnesium 3-in-8, or our Ultra MG, which is our tri-blend of magnesium. Thanks so much. We'll see you Tuesday. Take care.